Sorry about that, guys.
Okay, I think everybody should be in.
All right. All right, good afternoon, everybody. Man, I apologize. I owe you guys 10 minutes of your life back. I apologize for keeping you in that waiting room. That was all my fault. My computer, right when we are about to let you in, my camera went off and it couldn't get it back on, so we had to reboot the whole thing. So that is my bad, and I apologize for that. Can I see if everybody can hear me all right by a show of hands? Can everybody? Okay, perfect. Well, thank you all very much for joining us. We are here just to make sure you all have everything you need and anything else you could use to get reopened. If you are in this group right now, you should be part of our kind of personal services industry, where unfortunately right now we haven't been able to get you back to work, but we really believe, based on what we're seeing and doing, that we can get you back to work soon. And I know all of you all have already done everything, but we thought we would just get some input from you guys about what you're doing, so that we can inform our members and others in your industry of what you think best practices are. We can also on this call share a few best practices, and then we're going to point you to some resources as well, okay? And we should have you out of this call. We'll make up the time, and I apologize for that. So I'm going to abbreviate my presentation a little bit based on my tardiness to make sure I get all your input in there. I do want to share with you a few things just so you can share with others how we want to approach this, and it's so important. And I'm really proud of those who opened up so far this week that we've been able to reach, and they're doing it the right way. And we're calling it the St. Pete way. Let's see the next. Let me get my PowerPoint going here. All right, slideshow, play from start, and we're ready to go. Okay, so the first thing I want you guys to know is this number right here in front of you. This is going to be our kind of report card we're going to look at every day. Every chamber meeting is going to start with this. Every conversation is going to start with this. And here's why. We do not want to be pulled back into another close down, right? It's going to cost you guys a lot more money to try to reopen, and close. So the only way to do this is to know the data. And while the government is telling us they have the data and they're sharing it with us, they've given us some benchmarks for us to monitor so that we can really understand how close we are to being closed, how close we are to being open, so that you guys understand how to buy supplies, how to handle reservations, customers, everything else. And so the numbers I really want you to concentrate on are these, and so this is a scorecard. The green means we're going in the right direction. The red obviously means the wrong direction. And so what I want you to, direct your attention to this, and we're going to start sharing this every day, is these are the two boxes we're really looking at. This 4.8% is the number of percent of positive cases that we have throughout. So that kind of normalizes when you test a lot more. Are you seeing bigger numbers? You're going to see bigger numbers with testing more, but what's the percentage of positive cases? And so right now we are on a decline, and we've been on a decline for the last few days of 4.8%. Our mayor has told us that number has to be 6% or less. Okay, so you and I want to watch that really closely, because if it starts creeping up to the high fives after a week or two of people being out, you and I should be getting kind of nervous that they may not reopen us right away, or they may do it with severe restrictions or things that you and I may not even be able to open our businesses with. So I share that with you because that is the bellwether. This information is updated every night, and we're going to be sharing it every morning. The other thing you need to understand is this 10.4. This has gone down over the last 2 days, which is what we want it to do. This is the 14-day average of new cases. So that's that notion of what is that putting in the strain on our hospital system? Because what you and I realize now what flattening of the curve meant. Flattening of the curve meant it didn't mean that the virus went away. Flattening of the curve meant that the hospitals will be able to take care of us if you or I got sick or someone in our family did, and that's what we want, right? Our hospitals have given us the thumbs up that they're ready to open. They're going to open up their own other ancillary services, and they're doing it in a safe way, and they're asking you to too. Any questions about that, just so that I make sure people understand? Because I hate to be the data guy, because I'm not. I'm a marketing guy, but I really believe we keep true to this, everyone will know why we're behaving the way we're behaving, so that it's not a personal opinion that it's safe or that we should do it. But we all agree that these numbers make sense to us, and that's why we're operating our businesses and our community the way they are. All right, I got a bell on that one. I must have won something. And so just so you understand the trend here, this is that 14-day average that we just showed you. I just wanted you guys to see this, just again, to build comfort. And so you can build comfort with those you're going to care for. This was our high, this was what they call the plateau, where we all learned about plateaus now through all this media comments. And so that is, man, I'm messing up. There it is. So this is the plateau, and this is what we've been doing. I mentioned, like, I got the report on Monday and I was like, oh man, not the right day to open if we're doing this, but you can see it starting to decline again. So this is that 14-day average. So this is the best. So it's not the number of cases that we're really looking at, it's these two numbers, and we're going to share it with you. And all I'm saying is share it with somebody else so that they don't freak out about what's going on and they understand it. We wouldn't go out if it wasn't safe, and I want people to know that, okay? And you will get a presentation. So if you need it to share it with your employees, which I hope you do, or other folks, I hope you do, please do so. And any feedback you get, let me know. But everything is about safety first, and you guys know that more than anybody, but well, we're making sure that every business that opens from Monday on really understands that that is the requirement. That's not an option, that's a requirement. And it's just simply because there's too many people that we have to care for. Those that we've lost jobs, those that are in the hospitals, those that could get sick, those that have passed away. This is about people, and it's a lot of them, and we've got to act like we care about all these people on this chart right now. If you want to get these people back to work, we're going to be on our best behavior, and we're going to be the safest community in the country. We're doing it through this 4R method. You guys are now in this reopen stage, starting to talk about reopen, and our staff is starting to get really good at reopen, and we're going to show you those resources and you're going to share it. But there's a lot of still relief effort. So if you haven't applied yet and gotten Fighting Chance or Pinellas Cares or the PPP or whatever, our Navigator team is experts at this now, and at least can point you in the right direction for the other professionals in this community that can support you on this effort. So we know that you're not open yet. You're trying to, relief efforts are still available, and we hope you apply and we can help you with that. This is about reopen and the resources there. We will eventually have to start talking about when we recover. That means when everybody starts to get back, when we go into phase 3 and 4, how do we get everybody back safe? And if we get everybody safe, can we get back to the demand? Can we start advertising again? Like right now, we're not going to advertise to tourists to come down here. It's not safe yet. We don't know that yet. Now in a month it may be. In 6 weeks it might be, but right now that's where, so then there'll be tactics under that one. And the final stage will be when we all regroup again a year from now and go, how did your business change? What do you do different? What does the economy do different? Okay, so that's how we're going to do it, and that's how the chamber is going to start offering these services to you going forward. And again, why we're doing this is literally about this chart right here. You heard about it back in 2007 and 8 about the V-shaped recoveries or a U-shaped recovery for your economy. You can see what we have been told by the Florida economists that we work with directly, that if we do this correctly and go back once the right way, safely, we can be back to normal numbers by 2021, the first quarter of 2021, and have only lost 2.3% of our GDP. If you and I find customers and other St. Petersburgers not following the rules and all of a sudden we get sick again, we could go into a long U, they call it, and it could lose almost 9% of our economy. And you and I really won't have recovered till almost halfway through 2024. So I think you and I prefer the 2021, end of 2021 for all of us. So that's what's at stake for these kind of conversations about health and safety. Other countries have done it. This was me just showing that other countries thought they were ready. They went back and they didn't have the right systems in place, and they had to bring people back. Great countries like Hong Kong and Singapore went back without the right restrictions or the right health requirements, and they had to bring people in 30 days after, and that set them back. South Korea is kind of the model where they restricted movement completely, and then they super tested. We're trying to get there right now. We now know what all those gates are. This was about just that information I just shared with you. What data do we need to know? We know that now, and we're trying to get that for you. This was our recommendations on behalf of our members to City Council, and this was, hey, we need to get that data. So we've published our own data now. We didn't wait. We're going to get that data to you guys. But this part about Source Pinellas, I was late to get to fire up my computer because I was on the phone with the Pinellas County emergency department, and they are going to be, they have a list of local suppliers for these materials. We have a little of a list. Some other chambers have a little list. You have a little list. What I want to do is formalize that, because I think you and I are going to need this for a while, and so that you and I have resources. I'd also love to keep the money in Pinellas County. So if we can buy local from those who can provide the right kind of materials to us, we want to keep the money here so that everybody can benefit. So you're going to see more in the next couple of days about where you can buy materials locally, as well as then through other angles if we can't cover it. But we really are trying to get people to purchase locally if it makes sense, because the workforce that, Pinellas County told me directly today, make sure your businesses know, especially when you get into the dentists and doctors and others, they cannot take from the healthcare PPE stuff. So the governments are not supporting you as a business with your PPE. So if you call them up, you cannot get in their supply chain. So we need to create our own supply chain, and ideally not through a midnight Amazon raid where we're trying to click on everything and hoping one of them will deliver it to us. And then finally, this whole thing about tracing and testing, we're excited. We just talked to the hospitals again. They're providing 45-minute turnaround on their testing, and now that we're offering free testing to anybody in Pinellas County. It had a rough start, but it's getting there. So we're getting close to those other gates that you and I want, so that we can completely recover and get into the reimagined pieces. We're talking about this still. We can help you get the money if you need it, and we're trying to get the city governments and county and state governments to understand a lot of people did not still get relief, and we need to work on that. So please be ready to make sure you know your numbers so that we can get you the resources. I really think you're going to see another round or two of money even when you reopen that you should be keeping your eyes on, and we're going to help you with that. We've asked everybody to keep your guidelines configured the same way. We're very close to that now, with everybody agreeing on every guideline to open you up. Depending on what the state does next week, ideally our county and city will follow that in that same way. And that's where advocacy comes in from the chamber. We got to put the pressure on everybody to keep it so that there's not one rule for Safety Harbor and one for St. Pete or one for Hillsborough, one for, we got to keep it consistent. And that's what we're asking our governments to do. So you don't confuse your customer or the consumer by who's open and who's not. All we ask is that you communicate some of these things to your employees and through your social media and on your website about who you want in your system. Phase one means no vulnerable individual should be seen. So if you have employees that are vulnerable, or you have employees that live with vulnerable residents, you should say that's off the table right now, because that's off the table at every level. And then you should also just put off the table that we are not socializing in groups larger than 10, and we're still doing 6 foot everywhere we go. Those are just what the federal government and the state government have offered for us. We know who's open right now. We are trying to get you guys open, I swear, but we're working hard on that along with some of the other folks that may come next. But we've got a lot of folks starting today, and we're learning a lot from that. We are encouraging, and just as the chamber will do, we aren't going to open this week or next. I don't want to take any of the PPEs away from you guys. I can still telework. While I didn't show it well today by being 10 minutes late to your Zoom call today, I swear I can telework, and our members, our staff can too. And so we're going to keep going, but we're going to help those who can get out into your workplaces. We need you to get to work, so that's how this is going to work. These are all those. Again, these are these gates. I'm going to move on through these because these are just how the state and the nation have aligned in it. This is where we start going. The things on the left that you see, the photo, is all the gates we just talked about are you allowed to come out? When will personal services allowed to come out? Okay, they think you guys are about ready. Now you have to prove you have all the things in the middle. Do you have your guidelines, policies? Have you updated your employee manual? Have you updated your customer communications? Is all your signage changed? Are your gates and everything else, any customer touch or any customer queue, have you re-queued? Have you reconfigured your salon or your barbershop or anything else to make sure that people can't pass 6 feet away from you, that you don't create bottlenecks? So this is what this is all requiring of us. Now, the best part is we were able to negotiate with our city that we're not making you sign off on anything, and the government's not saying you have to do these things. I just gave you those things. You have to keep vulnerable people safe. You have to keep social distancing rules in order. You have to have groups of 10 or less, ideally just families. And so those are the broader spectrum. Now they expect us to behave accordingly, and I think we all need to do so. I always put at the end of this, always remember that whatever you're doing for these first couple of weeks, remember that we may have to be closed quickly. So I'd be very cautious about doing things that might say, hey, we're buying the big extra bottle of that stuff because we're going to use it and it only goes bad every 2 weeks. Man, you might have to close up in 2 weeks. I don't mean to be the bearer of bad news, but part of saving your costs is to really monitor all that, because I've been told by every level of a government to make sure I tell you guys you could be closed again. And that might be it. We're going to show everybody that we can follow these rules, and that's what we're trying to do. What we are really working on, and we've got the resource list that we're going to talk about, but I know most of you have already done it, is just OSHA guidelines are a good start. And now most of you have industry guidelines, and some of you who might be affiliated with other brand names, they've provided you their playbooks. And that's what I really want to learn from you guys too, of what you feel are some of the best plays that we can share. Because what we want to do in St. Pete is show everybody, man, these guys have it. They're sharing it, they're talking about it, and they do it the best. Okay. And so how we're doing that too is what we're trying to do is, if you follow these rules or if you want special promotion about it and you publish your guidelines to us, just send us your guidelines saying you understand what it is to mean to open the St. Pete way. We're going to promote the heck out of you too, because what we're trying to do is really make sure that the good players, the good actors, those who are conscientious about their business are seen as that, and then others will rise to where you all want to be. And that's how we're, that's wild, huh? Hold on one second, let me get back there. All right, that was my phone. All right, so that's what we're trying to do. We just started on Monday, and you can see all different kinds of folks getting into it. So here's how we can do that too. At the end of this, you can sign up to be part of get a business resiliency team member to join you. What that means is you'll get 90 days of navigation of your business to make sure that you get the relief efforts you need and to get these reopen efforts, and additionally get any other kind of guidance or suggestions from both the team and all the folks that we are getting to donate. So we've got attorneys, accountants, bankers, marketing people, mental health counselors willing to give you guys counseling. They're going to give you 30-minute sessions on the different subjects you might need. These are members that just want to help you too. I know you have your support, but it never hurts to get a second opinion on what you're working on. And we've got a lot of great burgers that want to help you do all this. Okay. And that's if you want to do that for somebody else and you want to volunteer your time. Kim Vogel's in the room today as well, but she can help you get signed up. There's her email. If you have some expertise or some ideas of how you can donate back what you are good at for these businesses, please do so. That's the St. Pete way. Just so you're aware, I mentioned my guidelines. We're following all the guidelines. We're publishing that we're following all the guidelines. We know May 4th, phase 1 was, and remote work continues. We believe we're really under phase 2, which is where we're already allowed to work. We work every day right now. Our offices, while they're not open physically, all of our employees are able to get to their jobs. And so we're not going to go back till a minimum of May 18th. And we have started our vulnerable population communications, as well as all these guidelines we're about to talk about as well. And we have not flushed ours out yet because we can't find the PPE stuff right now that we really need. And we've got some of the masks and stuff. We're still working on temperature checks and some of the disinfectants and things like that. So we're going to get there, but we're not in a rush like you all are, so that we're going to kind of stay back a little bit, and hopefully others do too, so you guys can get open. Okay, so that's that part of it. We're going to show you some of the guidelines here in a second, but I'm going to stop sharing my screen for a second, get you back on here. I'm going to pause before we go into that. What I'd really love to do now is, because I've got enough folks here, is I know you all have your guidelines, and or some of you do, and some of you are ready to go. Would someone be courageous enough just to say, hey, I'm ready to go. I've been ready for a couple weeks now, or weeks. Here's what we're doing, and just start off the conversation about how you guys approach this entire effort. And I'd love to take a couple of those, because that'll see the next part of this, which is, we're going to be recording those, because we're going to share this with others too. So if there's anything you don't want to be a trade secret, we're actually recording this. Too. And so we will share it with everybody. So don't share what if it's a secret, tell us it's a secret. You'll tell us offline, but we want to share this, and we want to start. Max, I saw your hand go up first, so I'll start with you, and then we'll get to Kirsten, who also put hers.
All right, so by the way, first, thank you for doing this, Chris. And mute your phone. You never mute your phone at any of these Zooms. All right, so very first, actually, you talked about temperature. So we're taking every client's temperature as they walk in the door. That's number one. I went to the dentist the other day, and he had a full questionnaire with everything, and I stole a copy, so we've now converted that over. So we're going to have a questionnaire for every client that walks in the door as well. Every thing from, travel to, vulnerabilities to, have you been sick, yada, 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 the whole questions that I'm sure a lot of you have already seen. I did just spend over $1,000 on COVID rapid tests that we're going to be testing our entire staff. So it's a 15-minute test, take the blood, we'll know if we had it, if they have the antibodies. So we're going to be doing that next week for our entire staff. I don't know if anybody else is really doing that yet, because you can go to different places, but we actually went ahead and got them shipped from a lab in New York, and we're going to be doing testing on all our staff in-house. Obviously, the social distancing, we could operate at 50% capacity here, where each station has the 6 feet distancing. We'll cut back in our waiting area as well. So the way I'm looking at it, at 50%, we could have 3 clients, 3 barbers on the barber side. We could have 3 in waiting, plus the 1 front desk / bartender. And that gives us 10 in the shop max. And so that maxes us out at 10 people. And we have 3, 3, 3, and the 1 front desk. So that will give us the 10 people. And just the sanitation. I mean, as barbers, we're already sanitizing everything already in between each client. Now there's just extra levels. I've also hired, I've got a Safe Pro, I believe they're called, Jeremy Shapiro. He does the quick draw mask. That's another thing. So we also made custom masks for the entire staff. We have gloves. We'll see about the end, because the masks are only to protect the staff. They're not protecting us from spreading it. They're protecting us, or I'm sorry, it's the other way around. But so it's protecting us from spreading it, not from receive. So if it comes back, because we did have a little bug in the shop in December and January that a few of my barbers had all those symptoms, but no one knew what it was. So we see hundreds of clients a day that are traveling and whatnot. So we think we might have actually had it back then. So that's why I'm actually really excited about these tests, to see if we have those antibodies. Because if we do, then we really don't need to wear the masks, because we've already had it and we have the antibodies there. But so back to Jeremy real quick. So Jeremy's coming in. He's got this new 90-day chemical. It's supposed to be arriving this week. And he's going to be spraying down the entire shop. And that supposedly for 90 days keeps anything from sticking to any surfaces, any viruses. We're still going to be cleaning, but supposedly this chemical helps with all that as well. So we've put all this in place. I mean, we had a sign on the door for the last few weeks, opening May 4th. Obviously, that didn't happen. So now my sign says Monday, May 18th, with a little crossing fingers. So we'll see, but we are ready. You can tell us to open tomorrow. I'll make myself ready to be open tomorrow. It's just, we got to go through the governor, then the county, and then the mayor. So hopefully everybody gets on the same page and we can all do this together and safely. I've seen a few barbershops in the area open. I've also seen them get shut down pretty quickly. I hope, everybody just does the right thing and waits it out like everybody else is patiently waiting, and we do it all together at once safely. You're muted.
Yeah, I agree. I agree with you. I see a lot of heads nodding about, the bad actors, and that's what we're trying to keep out of this. But I did, you were the first one to say that you've purchased your own testing. Has others purchased testing for their employees? So yeah, you're ahead of the curve on that one.
Hey, I guess that's an industry secret. We're actually going to hire a videographer to come in and film all of us getting tested, film the place getting cleaned. Just to give that assurances that we're doing everything that we can to make sure that our clientele is safe. Gotcha.
Yeah, don't be surprised though. I just talked to a doctor today who does those antibody tests to see, and she's 0 for 27. She's had 27 people come in her office confident they've had it. I had it in February. It knocked me out. I was down for a week, and she can't wait to find one that actually had it because so I'd be curious. I'm anxious to learn if your folks did have it back then. So
I mean, in a way, I kind of hope they did, but I also hope they didn't. Either way.
Yeah, because
we all want the antibodies. We all want that that immunity. So
right on. All right, thanks. That was well done, Kirsten. I think I saw your hand up next. So would you mind adding to?
Sure. So my company is Imagine Home Organization. So we're a little bit different in that we don't have our customers coming to us. We go to them. We're going into their homes to organize. So we have a really small team there's 4 of us, and we are we're going to be wearing masks. We have gloves. We'll be, disinfecting as we go, but we're in someone else's home. So we're going to be asking them, if they've traveled, that they're feeling well. We're waiving. Normally we have a 48-hour cancellation policy, which we're completely waiving so that if they do not feel well for any reason, they just cancel. And then, and the gloves and masks are to protect them from us since we're in their home. Then we'll also be doing kind of the double protection of social distancing so that when we normally are kind of side by side with our clients going through things or, making decisions about things they're going to keep, we'll be doing that from a distance. And we put up a system of they'll have a box to put things in that they want to get rid of. So we've figured out a way that we can be socially distant while doing something that's usually very personal. But I think, while we need to, that'll work and make it possible for us to do services when people need them.
I love that. Okay, that sounds like it's got a plan to it as well. Max, on yours, I just want to go back because I want to add to yours too. Did you say you're gonna survey your customers when they come in, but you're not testing or any?
Well, every client that walks in, we're checking their temperature.
You are, okay.
We have antibacterial that we'll make sure that every single client has to antibacterial their hands. And I'm printing out a pad. So they're gonna have to fill it out when they're gonna check it. They're gonna check too that they understand all everything and sign it. It's kind of also just, help with liability issues, I guess too, because we are personal contact. That's why we're not part of phase 1. But also just to make sure that they understand everything that is involved with this virus. And so it's a front and back page. They'll have to check each box, initial each box that they haven't traveled, they haven't had shown each symptom, and it's gonna make us feel safer. It'll make our clients feel safer that we're doing this, and sign it at the bottom. And
beautiful. So show of hands, who's gonna make their customers sign something? Okay, maybe about half of those. So, and that's something you need to think about. That's something, and when we've been in these rooms with others, that's up to you. We have seen it both ways. We have seen it automated when you're making your reservation, you can ask the questions and then check again. We do recommend that you have some coverage for that you cover yourself for liability. So having them at least recognize that they've been asked to do certain behaviors. While it's not iron-proof, and lawyers will tell you nothing is, you need to, what we've been trained to tell you guys is you need to show that you tried everything you could to educate your employee and your customer, and you need to write it down. If it is not written down, you did not tell them that. So I would highly recommend for all of you that you have your forms ready. We have sample forms, but there's a lot of others floating around, but make sure you have those kind of check-in forms for your employees as well as your customers every day. We're going to ask our employees to check in every day with that before they even start their day. They have to answer those same questions as well, and do that daily. We're going in shifts just so that if the A team unfortunately gets somebody who's sick, I don't lose everybody else, because if my A team goes, I'm going to sequester all those people, and I may lose them again. So we are thinking about shifting, and we've heard a lot of other people talking about think about creative shifts for your employees so that you've got teams in case someone goes down, you've got another team ready to go, and they might pull extra hours for you or pull extra duties. All right, so those are a couple other things. Who else wants to share what they're doing and what the beauty bungalow? You're my neighbor.
Hear me?
Yep, now we can. Yep.
Okay, so it's a dew treatment room spa, and normally we operate at the same time. Both rooms are going. So what we've done is staggered the schedule to make sure that we're not having clients cross over on the they're not crossing over on check-in and check-out. We've created protocols based on what our malpractice insurance has suggested. So we went through the company that we use for malpractice insurance, and we're creating a protocol from the moment they step through the door. Temperature, again, the form with the questions, that'll be kept with their temperature that day. They sign it and they sign off, releasing that they know aesthetics is a face-to-face contact, and that they still want to go ahead and get their treatment today, knowing the risk. And we're obviously going to be wearing masks. We're going to ask people to wear masks in the common area. Once they go in the treatment room, they can take it off, and then we'll have our mask and a shield. And we have all that stuff. We've written the protocols, and we're just starting to go through and rehearse it so that the day the client walks in, we know exactly what's going on. The clipboards, the pens, everything's sanitized. We're giving them a little bandana so that if they're in the treatment room and they happen to sneeze, they can cover their mouth, and they can also use it to open a door handle. First thing they're going to do is go in, wash their hands, sanitize. We're going to take their temperature. They're going to sign the form, and then hopefully we go in the treatment room and it becomes a little more normal and relaxed, and they get to enjoy themselves. And then we've added more time after the treatments, and we've cut down on the amount of clients we're seeing per day.
Can I ask you about just, you mentioned restroom, and we've had some debates on that. Can you explain how you're going to, are you doing anything different about your restroom maintenance or disinfecting?
Yes, the front desk person will be going in between. After we go in a treatment room, they'll be going in and sterilizing. We obviously have protocols for cleaning the treatment room and everything that we've always been doing with disinfectants that kill MRSA, they're medical grade, and COVID. So she'll go in and wipe everything down, wipe the door handle outside and inside, and make sure that everything's ready for the next person. And then she'll do the checkout. She'll have a mask on. The client will put their mask back on when they check out, and we'll have our mask on during that time too.
What I've heard a good idea is on your bathroom door, just may want to say, hey, we clean after each use or whatever, or after every, just so that if you're making them go into that door, the first one, you really want to impress upon them that you knew they were coming today, right? So, so just signage is everything. I really believe that part of it is just reinforcing it everywhere you look will be really important because it'll remind everybody, both employees and customers, what you're trying to do.
We're sending out emails, and we're going to put it in our social media, and we've changed the verbiage on our cancellation policy. Just remember, if you're not feeling well, blah, 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 go ahead and cancel and let us know. There's no penalty. So I think that's the most I can try to do to be careful and keep everyone safe, and obviously keep us safe because it is face-to-face contact with people.
So well done. I appreciate that. And that's helpful. And I think that is, you have the best part of most of our personal services members, they have their own databases. So ideally you're communicating with them directly. And what I would ask is, and once you send us your guidelines, we'll send you a digital poster as well. Tell them that who you are. We're a safe business. We're trying to be a safe business. Keep promoting the heck out of that, because one of your customers will share that with somebody who's not being safe, and you'll get an extra customer out of the deal too. So
I've had some calls already from people asking if we're working, and I'm like, no, obviously our state and our city has not released the mandate yet, and they're like, oh, well, so-and-so's working, at the med spa. And so, of course, I call because I'm curious. I'm like, oh, are you doing facials? And they're like, yeah, we're doing facials. We're in a doctor's setting. We have a doctor overseeing us, so we're allowed to. And I'm like, oh.
Yeah.
The client that called me, she goes, well, I certainly don't want to go somewhere that's not safe. And that was her, that was her take on it. I said, well, I don't know what they're doing there. I said, all I know is I'm listening to my city, and I'm trying to go by the mandates that we were put in place, and that our license and our insurance won't cover us if something did happen. So.
Right. Yeah. I'm glad you said that last part, because you could kind of sneak around, but if something happened, you guys would be really exposed. I mean, you'd lose your business on a deal like that. If you try to sneak it in and something, God forbid, happened, that's because the governor orders is the governor's orders. You would have no defense at all. So I'm glad you're doing that. And yeah, there are, because when they opened those emergency operations at the hospitals, that opened up all those kind of medical facilities of any kind, from mental health to massage by prescription and all those. So those are operating in an environment. And if you're in a doctor's office and you do that, the only part that supposedly the rule is they can't use any of the PPEs that they get from the state or federal government, that they have to supply their own if they're going to do those kind of things. But yeah, there's some competition out there right now doing probably some of the things you guys would like to do today. But I think it's in limited supply, but we'll watch that. Who else wants to share what they're working on so we understand, and if there's anything else new about what we've heard or any concerns about it? Jim?
Yeah, thanks, Chris. I'm just looking at, so folks on the call, I operate a portfolio of supercuts. So I have the benefit of a franchisor out in Minneapolis who is also working with the University of Minnesota Medical Center and their infectious disease team. So we've been getting a lot of good advice from them, and I don't want to cover things that others on this call, like Max, have already said, but a few other things come to mind. We are doing we're obviously not using all of our stations because we can't adhere to the 6-foot distance. So we're going to have down stations, but we are putting a physical barrier in place between each station so that there is isolation between stations. That's not something our layout has typically had in the past. We've typically been a walk-in service. We're going to be appointment only. So we're not going to be taking walk-ins just to manage the customer flow. Folks that have opened already in states where they're open tell me that that's worked pretty well. People get it, they understand. We've gone to receptionists in salons where we have not typically had a receptionist. That role is to manage some of the guest flow, do some of the guest check-in, temperature checks, handle the bathroom sanitation, things like that as well that have already been mentioned. Capes that typically would get multi-use are going one use and then right into the washing machine. And I think the last one I see on here that is maybe a little different is we've consciously gone to a reduced set of services for the first few weeks. So, we do color, we do above the neck waxing. We're not doing any of that. Some of that is to avoid the close contact. Some of it is to just manage the customer flow. Color processing takes 2 hours of someone end-to-end service. We just want to get more people through to be able to get the haircuts done. So we're just not going to be doing color for the first few weeks, which is unpopular, but necessary in terms of trying to get as many people into the salon and not have too many people hanging around. And I think those are pretty much, we're not using our wait areas. That's only going to encourage people to be coming in and sitting around. So we've turned the wait areas around. Everything else sounds like it's been covered, but those are some of the headlines.
I appreciate that, Jim. It must be nice to have that kind of support at that higher level. Sounds like those experts can really do it. And so I do want to bring up that appointment only is going to be trending on every piece. The retailers are even doing that now on their 25% because they're having trouble a little bit with traffic flow and just trying to manage people and people waiting outside their doors. And then all of a sudden now you have 10 people outside your door and you have a problem. So I see a lot of trending now for appointments for everything. So it, like you said, it might become the norm right now that, and we should probably, we'll start in our communications to check ahead, make a reservations always nice, those kind of things to encourage that we just don't have walk-ins that could create kind of a flow problem for you guys in your lobbies and other areas. So I think that's a nice one to add to our list as well. The physical barriers you're putting in, are those manufactured or is that something you're purchasing or you're creating or out?
It's actually one of the vendors who supports us with a lot of our graphics has created those, and of course they're branded and everything, on brand colors and all. But some of our competition has had physical barriers between stations. We haven't, so we're just putting those up as another way to just reduce transmission.
Gotcha. Thank you. All right. I've got about 10 more minutes with you, and I want to show you some of the other resources and introduce you to Kim Vogel, who's got another, we did a workshop yesterday with W3, which is an insurance company here in town. They've been here since, started in 1924, 25, but they're really good at risk analysis. And they've offered, if you contact Kim and get into the navigation system, they have a tool where you can answer 15 questions and they'll put out a report for you all that shows you more of that information and where you might be vulnerable as well. And it's a free service. It's something that usually costs a lot of money. So for smaller businesses who just want to double check their guidelines, and it certainly would be a nice thing to have in your file if there is any reliability conversations that you had, you had a survey checkup on this just to see if you were doing the right things. I'm kind of encouraging you all to take us up on this just to protect yourselves. You may get an A+ on the scorecard, but you may realize you've skipped something completely that needs to happen. So do you mind if I just introduce Kim and have her talk a little bit about how she'd like that, how she can help you with that, so you are buttoned down, and then if we have any time left, we can go into some of the other questions that were answered. So Kim, can you just help people understand how you can help?
Hi, everyone. It's great to see you all. Thank you so much for being on this call. Really appreciate it. Aaron, look at how long my hair is getting. Thank you. Anyway, so excited, you guys. I know.
All right.
Sorry to distract everyone there for a second, but so our business resiliency team is truly here for you as small business owners. We are a group of navigators. It's exactly what Chris said. We are literally here to walk you through and to take this journey with you. Actually, a couple of the navigators are on the call here today too, and we have kind of it's a quick little process. It's a quick little intake, but then their whole goal is to continue to follow up with you, to provide resources, to make sure that you have the most updated information. There also is if we see news and we see all sorts of stuff coming up all of the time. If you have questions about anything that you see, we want you to call your navigator and say, okay, wait a second. I'm pretty sure that I just heard the mayor's office or somebody say this, this, and this. Is that right? And we are trying to keep ourselves as educated as possible so that we can share as much updated information as we can. Our goal is to help you feel a sense of stability within 90 days. We know that business may not be back to where it was pre-COVID, but we also want to make sure that your doors continue to stay open because you guys are that important to us. And so we are going to take this journey with you as business owners, making sure that you have resources, that you have good, solid information, and that you can continue to build up your client base. We also want you to know that long-term, we're here to help you build strategy. So what is business going to look like? Our new normal, we still don't know what our new normal is yet. And until then, we're going to continue to brainstorm and to work with all of our industries, making sure that you have exactly what you need. And if we don't have answers, we're going to get answers, but we are also here just to listen to your stories. So thank you so much for those of you who have been sharing your stories, because it is making a difference and it is making an impact, and it will continue to in St. Pete, but also within your industries too. It's really easy to get in touch with us. You can find information about the BRT at growsmarterstpete.com/BRT. Share your business information with us there, and then we will get you assigned to a navigator. I know that there's a few of you already on this call who have been working with navigators and have already got some referrals where you've been able to talk to kind of a business expert. So thank you for that. And your stories, again, are powerful, and we're going to continue to be here to support you. Thank you.
Awesome. So I hope you guys take her up on that, or if you know of another business that might not be as far along as you, and you say, hey, you guys should do that. It's a free service. It's being paid for by a foundation, by the city, by the chamber, and by a lot of members. So take us up on that. Candace, do you have that one form that we showed yesterday? That I want to see if they're interested in it. Let's see. I'm going to bring up a form real quick. And while she's bringing that up, if you look in your chat box as well, Max has posted the Safely Sanitize USA. That's that 90-day misting product that he put in there. So I learn about that. I know we're seeing that a lot. I was at Pronto Car Wash today, giving them their new open signs, and they're doing they have something similar, but for inside of cars that you can safely sanitize your car. Similar with a misting product. So I think you're going to start seeing more kind of general understanding of those kind of products in the marketplace. And so you just may want to investigate it and just learn more about it. Okay. We're able to find that, Candace?
I'm actually,
okay. Well, okay.
Actually, I didn't have that up. I can find it. Just give me a couple of minutes.
Well, while we're wrapping this up, just because I want you guys to see that it's a pretty robust report you will receive, and it'll have links to if there's a deficiency in your plan. It'll ask you 15 questions. Depending on how you answer it, if they feel like you answered it with a little bit of deficiency, they've got different resources that they've created, but also of all the different industry sectors and all the other just safety and other resources for employee contracts to signage recommendation, just everything again. And I know you guys have a lot of it. I just think it was a nice way to package it all and get it to you guys free of charge. So I'm going to we'll send that back out to you all directly. Oh, look, Candace might have it for us if you can stick around 1 second. Yeah, that's it. So,
and Chris,
yeah.
There also is a number of folks on here whose businesses I recognize because our navigators have already been working with them. So please feel free to reach out to your navigator, and we will also, like I said, our navigators are on this call too. They will also make sure that they share this information back out with you too. So communicate with them. We'll make sure we communicate with you, and then we should be able to get you this information as soon as possible.
So thank you, Kim, and I will. But so you can see, this is the first 6 pages, and so just stay there for 1 second, Candace. This is like this, so they ask you first 6 safety questions, and the question is in black, and then the response. This is what would come back. You would fill in your response, and this is kind of a sample. They have these different blue areas where you see, this first line, specific templates and checklists, toolkits, templates, all the different things are hot links to what they have put together that are both industry standards and their own. So I know that the internet's full of all this stuff, but I think this is way more specific for businesses, and they actually have one for personal services. So if you do this and you're like, you know what, this is something I really want to do more of, sit with these folks because they can help you do that as well. And I think it's just worth the time. So that's what we're offering as part of you doing that. And then finally, Candace, can you just bring us to the last slide or our last PowerPoint? Oh, you know what? Just give us the camera, and I want to do one last thing for everybody. So I know it sounds like everybody has all their PPEs. We have a limited supply of masks. These are 3-ply. They're individually wrapped. They can be used for your customers or your employees. We went ahead and just purchased about 80 boxes of these. And they're $40 for 50 of them. If you want some, just let us know today, and we'll have them delivered to you. And ideally, a check would be awesome for them. $80 for 2 boxes. We're not marking them up. It's what we got them for. But if you have them, great. If you know of another small business or a chamber member that's scrambling and wants to get open, we'd be glad to make sure they have those. That's what we're just trying to help with that. And I see a question from Max before we go.
You know, it's because that was the question I was going to ask you about masks. So there's a chance that they might say that clients have to wear a mask coming in. Now we're seeing right now, I mean, at 50%, we would probably be at like 60 to 70 clients a day. That's going to get expensive. So you just brought that. I mean, do we have access to more than what you just showed? Like if I needed to buy a case of them, a container ship of them, I don't know. But like, is there, because I mean, the prices I'm getting are just outrageous. I mean, $2.50 a mask is just crazy for those 3-ply cheapo, just.
I know, man. I know. It's amazing to me. But luckily, we get, like I said, $40 for a box of 50. We were able to get at least under $1.
I'll take the 2 you offered.
Perfect. Good. So, hey, why don't you guys, if you want them, put them in the chat right now, and I'll have my team make sure that we get those, because I want to get rid of them. They're not doing me any good in my living room here, but I will want to get them to you guys because you spent the time with me. You shared your policies. The other thing I want you to know is that sign that's behind me is yours too. And what we'd like to do when you get ready to open, because you're a part of this and because you're going to share your guidelines with us, we're going to do a special promotion for you all. We're going to come out to your place. We're going to take a few pictures. We're going to post you and put you in different presentations about good businesses that are willing to take some time and learn about safe practices to reopen safely. So please take us up on that advantage. We've started our social media push on Tuesday of this week. We're already starting to get some steam on it. I'd ask you to be part of that. I need to see a lot of these blue and yellow around St. Pete just so we feel safer and people start coming out. And Kirsten, I see you have your hand up. Or
yeah, well, I wanted to know, you guys talking about masks, what about gloves? If there's a local resource or just a resource, like you said, besides Amazon.
Does anyone have their local source? Because, okay, Beauty? Oh, you're on mute.
Oh, I didn't have a source for the gloves, but I do feel like the gloves get very misused, I guess is the right word, because I mean, I almost think you're better off just to wash your hands and wash everything. And if you're wearing your mask, you're not touching your face. But the minute that you're going in and you're touching this, you're touching that, you're touching all these things. And then unless you're like immediately removing them, like you have to be so careful. And I've just seen, I went out to the beach the last couple of days and stayed at a hotel, and I watched, you know, them wearing the mask and wearing the gloves, but they like touched bottles and touched this and opened the door, and they had the same gloves on all day. And I'm like, that is not doing any good. So I think we're just sometimes better off just to wash our hands a lot and use sanitizer. And the glove is like in a sterile, like I'm going to go in my treatment room, and when I do one particular thing, I'm going to wear that glove and then I'm going to take it off. So I don't know.
Yeah.
Something to think about. You don't waste money on gloves if you could wash your hands and keep them clean.
Yeah, so this is going to be where it, I asked, because I just called the health department and the emergency office before this call to make sure I'm not telling you guys anything that they wouldn't tell you as well. And I asked about gloves. First of all, they said stay away from booties and surgical gowns, because those are what the COVID-19 respond folks need. So that is in short supply. They're asking any business not to do those. They don't feel like your business would need those anyway. When it came to gloves, they feel like unless you really understand gloves correctly, the way you just described how they're being misused, that it's actually doing a disservice, and they would rather see hands being washed on a rapid and regular basis over gloves that are being misused and thinking you're safe. So I think it's about training of your employees. If you feel like your employees are trainable and you feel like it's a better solution for you and your customers, I would go with gloves. I would also believe that another strategy is washing hands after everything you touch, washing them again, you know, like just understanding that piece of it as well, just because of the pure cross-contamination that gloves are proving to cause. So I think it's about employee training, and that's what, it's going to take some time.
I have one comment for you, though. I know we're not encouraging visitors, but I will say that the beach is filling up with out of state. Everyone is driving down. Massachusetts, Ontario, New York, Connecticut, Ohio. Like, it's going to be a big weekend out there, I think. But, and of course, people want to get away. But I was just kind of like, oh boy. The hotel was at a 10% occupancy rate, which was nice, but I'm sure by tomorrow it'll be up. And there was
it's going to be, yeah, I agree with you. And we did an interview with the Don Cesar, and their numbers are popping way up. So they're seeing it. It's unfortunate that people from around the country are coming here. I love that, and we'll have time for that. That's not the time for it now. We don't know where those people have been, and we're not safe ourselves yet. But that's going to happen. The thing about masks that I'm telling everybody, and we talked about it at our board, so I'm not speaking out of turn here, is the governor and the county and the mayor have all recommended it. And we understand we can't tell you what to do. But we also know that this first step or two is about, the perception of safety as much as safety is all. Because literally, guys, we have viruses in our body today. We're all living with viruses everywhere. So the viruses aren't going to go away, but the notion of getting people back out is about the perception of safety for everybody and being safe. You're not going to see me in public without a mask on. Do I believe I need one? I don't know. But I believe it provides confidence in the market that leaders like you all are wearing masks when you're going face to face with anybody. I just think it's the smartest thing, because why would you want to get anybody sick? We now know that 80% of these folks that are getting tested don't have any symptoms. You and I can have it today. For us to be that reckless with the people we love, to say that it just doesn't work for us, you're making that decision on your own, and that's a values decision. And as a board, we agreed that we're going to be seen as leaders that are going to kind of just say, we're going with the recommendation of the governor. And if it's a face-to-face situation, we're going to go to a mask. If we're in our own office or we're a social distance situation, we're not. But if it's face-to-face, we're going to do it. And I'm going to do it just to show people that it's okay. You can still be cool, still get everything done, but safety is our number one concern. So you're going to hear that from me all the time. All right.
It looks like Erin has her hand raised. Do you have something to say, Erin?
Yeah, thanks. I think that for us as a business, we're trying to find a balance between, being safe, leading in our clients being safe, but also not being perceived as part of the healthcare industry. Like, we are hairstylists, and we don't plan on taking temperatures. If that's a requirement, we probably will wait to open. We're gonna absolutely wear masks, but we want to find that balance between being accountable for providing a safe environment and making sure that our clients also take on their own responsibility of the risk they're taking and making themselves safe. So I think it's important to me to mention, like, there has to be a balance between those two things in a touch-based industry. So I think the other things that I wanted to share with you guys, as a salon, we have removed our front desk. We don't need a front desk, and we can take payment at the chair, and that way we have less interactions between clients and other people in our salon. And I don't know if you guys have mentioned this, but we move products into a cabinet that so that it's behind closed doors, so we're not trying to remember if somebody touched things and have to sanitize it. And we're also asking our distributors for direct links. So we're literally looking to push our industry to provide us resources so we can just get our clients products delivered straight to their house, and then we don't have to have that as part of necessarily such a big part of our business. So those are the things I wanted to share. Thanks.
Those are great things to share, and it is what we're all wrestling with, about just the understanding of what's the right balance of all that. And I'm glad you're at least understanding that there's so many different opinions on it. Yeah, that last point you brought up, and darn, I just missed it. Your last point was about Oh, darn, I forget. I just spaced it, but it was another one of those safety ideas. I forget what you just.
Products?
What's that? Oh, products. Yeah, thank you for products. Yeah, that thank you, because just what came out in our retail conversation about products is making sure you can get your vendors and suppliers to work with you so they're not part of the problem going forward. So if you can have creative shipping efforts, you should do that. You should ask your suppliers, can they ship right to my customers? For one thing, but then also, can they drop ship in the back? Like, just don't let them come through your front of your place. Don't let them, schedule your drops, shipments, do whatever you can, because those folks while they're trying to be safe as well, they're one of those kind of, they could be one of those mass spreaders for you. Like, so anybody who's delivering stuff is seen as one of those folks that is a risk for your business if they're in your business. So keep anybody who's delivering anything out of your physical business. All right, and that's just what I'd heard as a good guidance as far as just making sure that you're controlling all those folks who have been around other places that you don't know where they've been, because you don't give the same questionnaire that you're going to give your customers to the guy who's delivering a box of whatever's, right? So, but you just had an interaction with them and you don't know what just happened. So keep all those supplies and be creative with your shipments. All right, so I know I've gone over the hour. I apologize, but it was actually the 10 minutes that I was late. So I owe you, and I really do. I mean that. I apologize. I see that some folks have asked for some masks. If you do want some, please know that I have them. As long as I have them, I'll keep selling them. I'll keep selling them at cost. I'm going to order some more. And I'm not going to be your I'm not going to be your dealer on this. Don't bank on me getting them for you guys, but I would gladly get rid of everything I get and get them into your hands. So we'll get you what you've asked for now, and check back with me when you get ready to open. And if I still have some more, I will make sure that you get them as well, because they're awesome and they're at a price that can't be beat right now. So I want you to have them. Is there anything else for the good of the order? Was this of value to anybody by thumbs up or anything? I mean, did this help at all? Does it feel good to be part of something bigger than yourself there on that? Okay, I appreciate that. If you didn't get what you needed on that, will you let me know that as well? CEO@stpete.com. If you're like, man, this was just off base, didn't help me, you wasted my time, I need to know that too. I don't want to do that. That would be unfair to everybody. We're just trying to do our best. We've got our staff on the line who's literally just, like Kim said, really enjoying this mission right now of helping, and they've had great results. So ask for some help, and maybe you can be part of our success stories as well. Thank you for my team who helped me today get this all going, Candace and Courtney. Thank you, Kim, for joining us, and everybody else. To my members, I appreciate you. Good luck. Please keep in touch with us and let us know how it goes. And when you get reopened, let us come promote you and take some pictures of it, okay? Thank you all. Have a good day.